I'll teach the patient antenatal exercise, which is ankle exercise. So for that, the patient will be in supine lying with the leg rested on the pillow. So firstly, I ask the patient to move upwards and downwards. So I ask the patient to repeat for 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I ask the patient to do in a circular position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Bridging exercise. Bridging can help strengthen the core, hip, and gluteus muscle. To perform this exercise, patient must in supine and bend both knees. Then lift up the buttock as much as possible, but no need too high. Then hold 3 to 5 seconds in that position and relax. Do 10 repetitions.
Butterfly is an easy exercise and we can perform it with a minimal help, and it helps to stretch the groin area and also the hamstring while eradicating the abdominal discomfort. So first sit on the floor or in a mat and then straighten your back and then also straighten your leg. Now bend the knees and the feet toward the pelvic bone, okay, and then slowly move and join the sole of the feet together and bring them as close as possible to the groin area. Now hold your feet together and then slowly press down your knees as low as possible to the floor, and also bend your body forward. So you press, lean forward. So you will feel the stretch spread throughout the inner thigh and also the outermost part of your hips and also your lower back. Do not do a jerking here. It is okay if you not touch the floor, just go as low as you can. Do this as long as you feel comfortable. If you feel pain or discomfort, you can stop doing this exercise. So the benefits of the butterfly exercise, it helps you eases tired leg during pregnancy, and also it helps you improve your flexibility of your thigh and your hips.
16. So today I'm going to do the cat and cow pose. So the benefit of this exercise is it will improve the circulation in the disc in your back, and also improve your posture and your balance. So if you feel any pain or discomfort during this exercise, please stop immediately. You can do this exercise for 5 to 10 repetitions and do this for about 3 times per day. So first, start with your hands and your knee. Make sure your feet is flat on the floor. And now, inhale and tilt your pelvis back for cow pose like this. And now exhale and tuck your tailbone for a cat pose like this. Inhale, exhale, inhale, exhale, inhale, exhale. Okay, and then relax and end this position with a child pose. So that's all.
For child pose stretching, the patient will be in the quadruped position and need to move the knee apart about the hip distance. Next, patient need to move the hip towards the thigh so the bottom can rest on the leg. So now on exhale, lower the torso between the knees. Extend the arm alongside the torso with the palm facing down. Relax the shoulders toward the ground and hold this position for 15 seconds. So this stretching exercise, patient can do it for 5 times repetition.
Good
day, I'm Kalimani Annaprumpa Shanmugam from BPT16. Today I will be demonstrating two exercises, one for antenatal, another one for postnatal. First, the antenatal exercise that I'm going to demonstrate is bird dog exercise. This exercise helps to create core stability in abdominal muscles, hips and pelvic floor and shoulder. It also encourages a neutral spine and also improve low back pain. For this exercise, you need to come to quadruped position and keep your spine in neutral position. To do the movement, extend opposite arm and opposite leg out. Do not try to get the leg and arm as high as possible. Hold this position for 5 seconds and go back to the starting position. Complete this exercise for 15 repetitions.
Today, I'm going to show you wall press exercise for antenatal exercises. The aim of this exercise are to strengthen your pectoral muscle, which is your chest, your deltoid, and your tricep muscles. Okay, you need to stand a couple of feet from the walls. Okay, make yourself comfortable. Okay, and then place your hand on the wall, slightly bigger than shoulder width apart. Okay, and then your neck must be in neutral position. Okay, and then slowly bend your elbow. Okay, and lower your chest until your chin close to the wall but not touching it. Okay, up. Okay, going down and push up to your static position. Down and push up to static position. Okay, remember to, when you're going down, you need to breathe out, and then when you're going up, you need to breathe in. Okay? Okay, you can do these exercises 5 to 20 repetitions 2 times per day.
Next exercise is sumo squatting. So the purpose of this exercise is to facilitate the expansion of the birth canal, and this will help an easy descent of your baby. Besides that, it also helps to strengthen the glute muscle as well as the leg muscle, which is it include the quadricep muscle and also the inner thigh. Okay, so as your leg muscle becomes strong, it will help in labor and the final push to give birth. This exercise is contraindicated when the baby is not in an optimal position, which is in the bridge position where the baby face and bottom are presenting after 30 weeks of gestation. So we don't want them to descend in this direction. Then it is also contraindicated if the mother have any medical or pregnancy complications such as placenta previa, risk of preterm labor and others. Last but not least, if the pregnant mother experiences pain while doing squatting exercise, stop immediately the exercise and go to see a doctor for it. So now I will demonstrate the sumo squatting exercise. Okay, first, have your feet wider than the shoulder width apart with toes pointing outward, which is externally rotated like this. Okay, like this. Toes pointing outward. And then lower yourself into squat position and hold for 5 to 10 seconds. Okay, lower down like this. And remember to only go as far as you are comfortable while keeping your back straight and knees behind or in line with your toes. Then keep your leg turned up through movement and make sure your knee do not cave in toward each other. And then return to starting position like this. And perform this exercise for 5 second hold, 10 repetition and 2 to 3 sets.
Stand with feet about hip width apart. Then take a large step forward with the left leg. For balance, do not place the left foot directly in front of your right foot. Lower your body by bending knees, not passing the toes, until front thigh parallel to the floor. The back knee should not touch the floor. Most weight bearing is on the front heel. Always keep your torso or trunk upright and straight by facing forward. Exhale when return to the start position.
Kegel exercise. How to perform this exercise? Patient can do this exercise in any position that patient comfortable, either supine lying, sitting or standing. Then try to squeeze pelvic floor muscle, like try to hold or stop from P. Hold the squeeze 8 seconds and relax 8 seconds. If cannot hold for 8 seconds, just hold as long as patient can. Repeat as much as can, about 8 to 12 squeeze, 3 sets. Keep breathe while exercise and try not tighten the buttock.
Now I'm going to demonstrate postnatal exercises, which is knee rolling exercises. Okay, this exercise is purposely to strengthen your oblique abdominal muscle. Let's go. Okay, first, in supine lying, patient needs to bend the knees. Okay, hands on the stomach. Okay. So, you need to pull in your abdominal and roll your knees to the right. Okay. Go as far as you can. Okay. And hold it for a second and then go back to its neutral position. And then go to the opposite side. Hold for a second. 1, 2, 3, 4, 5. Okay, go to the position. Okay, you need to do this exercise 10 repetitions and 2 times daily.
Second, the postnatal exercise that I'm going to demonstrate is heel slides exercise. This exercise helps work core a little bit more while still practicing the pelvic floor contraction. For this exercise, lie on the bed with knees bent, spine neutral and arms at the sides. Begin the basic breath by inhale through your nose and exhale through your mouth to engage the ABS. Then slowly slide one leg out with inhaling until it is parallel to the bed, and then exhale as slides it back into the starting position. Then repeat this exercise to other side of leg. Perform this exercise 20 repetitions on each leg. Remember, we should remain neutral back position throughout this exercise.
Postnatal exercise, I ask the patient to do breathing exercise. So for that, the patient will be in supine lying. Then the both knees will be bent. Okay, bend knees. Okay, then I ask the patient to bring the pelvic upward. Okay, okay. Hold 1, 2, 3. Go down. Up. 1, 2, 3. Go down. Okay, up. 1, 2, 3. Go down. Okay, up. 1, 2, 3. Go down. Okay, up. 1, 2, 3.
So the exercise is leg raises. This exercise begins on the 7th day of postpartum. So first we need to lie down on our back, on the mat or on the floor. And then we need to bend one knee and then slowly raise the other knee upwards. Okay, so 9, 10. Remember to straighten the knee and also point the toes upwards. Okay, and then slowly put down the knee and then repeat the movement with the other leg. This exercise we have to hold for 5 to 10 seconds. You can do 10 repetitions and 1 to 2 times per day. So remember to breathe normally while doing this exercise. If you feel pain, you can stop doing this exercise. So the benefits of doing leg raises exercise is you can tone back up the leg and also abdominal muscles, and also you can improve the blood circulation.
Such that pelvic tilt exercise also one of the postpartum exercise that can be performed by the mother. The purpose of this pelvic tilt exercise is to relieve low back pain as well as improve hip mobility. Besides that, it also helps to normalize the alignment of the pelvic bone, as pelvic bone can be disturbed by the alignment changes during pregnancy, and this exercise also helps to strengthen the abdominal muscles. Okay, now I will perform the exercise. Okay, first, I want you to lie on your back with knee bent and feet flat on the floor. After that, place your thumb or finger on the prominence above the hip, which is your ASIS. Gently move your belly button into your spine and push your pelvis up toward the ceiling like this. Okay, tighten your glute and hip muscles as you lift your pelvis forward. Make sure your tummy stay in during exercise and don't let your buttock come up off the floor. Okay, one more time I will demonstrate the pelvic tilt exercise. Okay, I want you to perform this exercise for 5 second hold, 10 repetition for 2 to 3 sets. And other than that, pelvic tilt exercise also can be performed in standing position. I want you to stand with back against a wall, okay, like this, and have your feet out from the wall a little, okay, with knees, so which is your knees slightly bent, okay, slightly bent like this, and then gently tilt your pelvis or move your pelvis bone toward in your ribs, like this. This should be press the small amount of your back against the wall, and then hold this position for 5 seconds and then relax, and then repeat for 10 to 15 times. Tilt your pelvis forward and backward, forward and backward. Same like before, perform this exercise for 5 second hold, 10 repetition, 2 to 3 sets. Okay? It is advisable for you to see a doctor if your low back pain does not improve for further investigations and treatment.
Okay, now I'm going to do the head and shoulder raising. So first, lie on your back. So on the second day of postpartum day, you can ask the patient to try to lift their head as much as possible until their chin reach their chest without a pillow, like this. So on the third day of postpartum day, you can ask the patient to lift both their head and also their shoulder, like this. So you can gradually increase the repetition until the patient able to do 10 times.
Okay, now we will do cat and camel exercise. Now, slowly raise the head up while dropping the belly button as low as to the mat as the patient can, arching the back, and hold this position for 5 seconds. Next, we will do the camel position, which is drop the head down and then contract the abdominal muscle. Raise the belly button up toward the ceiling and also hold this position for 5 seconds. The patient can do this exercise 5 to 10 times repetition.
Stand facing away from the wall. Slowly lean your back and hit against the wall. Gently lower into half squat position. Keep your back flush to the wall. Hold this position for 30 seconds at start or as long as you can. Try to increase second hold by 10 seconds each time, aiming up to 2 minutes. If not, hold for 30 seconds with 5 repetitions.